Welcome to Boston in Common. We are talking today about maternal health in the city of Boston. Dr. Liza Swedarsky, thank you so much for joining us today.
Thank you for having me. It's a pleasure.
Wonderful to have you here. We'd love to hear about your role in maternal health as a physician and what inspired you to get into this work.
So I practice outpatient gynecology and minimally invasive surgery. I am an associate gynecologist at Brigham and Women's Hospital, and I've served in 7 of Boston's community health centers. What inspired me in terms of my path in medicine was very personal. Growing up in a family where we struggled with poverty, housing insecurity, food insecurity, as we know, many of these factors contribute directly to our health. When I got to college, it was the first time I had health insurance, and originally I had planned to be a scientist, but redirected because I had such a passion for caring for women.
Here in Boston, in our Health of Boston data reports, we see specifically around our maternal health, we are seeing a lot of disparities among birth rates among babies. Can you share in your practice, in your work, what are some of the contributing factors that you think may be causing a low birth weight?
The first thing you have to think about is, what are our challenges as Black and Latinx women to begin with? So we know, by and large, even before we become pregnant, our communities are suffering from disparities and more likely to have hypertension, cardiovascular disease, type 2 diabetes, stroke. These are things that are already affecting our communities. So once we get pregnant, if we're already walking into the doctor's office with health conditions, then it's going to make your pregnancy a lot more complicated to navigate, and the health of your baby will be affected.
What are you seeing across the city and in the city that might be contributing factors that create these poorer health outcomes?
So when we first think about access to care, which is one of the major social determinants of health, we have to look at our communities of color and think about access. Do our facilities have equitable resources that potentially hospital practices have? Is that provider supported? Is the ratio of doctors to nursing staff comparable to what other patients are getting around the city? One of the things that I've found when I work with women very closely, one-on-one or in these small groups that I run, when we talk about what keeps you from getting the optimal health care you think you deserve. So when we think about social determinants of health as well and how it contributes to the health of a baby, or a birthing mother, what about access to food, healthy food, education around nutrition and food, especially if you have a certain environment at home where there are certain traditions or foods that you've been accustomed to that may not be the healthiest options for you as an individual or for your baby, but also finding support to live a healthier life, which is challenging. And as we know, to eat well, it often requires resources. It requires dollars. It requires availability to healthy food. And weight is also a topic that often comes up. You know, I know that I'm supposed to be eating well and exercising, but I don't have time. Mothers, yes, or someone who is planning to get pregnant. But there has to be a level of trust when you're going to talk about weight, because it can be a very sensitive topic. So if you know that you're overweight or there's a more ideal weight that can create a healthy environment for your baby, but you're working 2 jobs, or you don't have a place to actually work out, or you're lacking motivation because there's stress in your workplace and in your relationships.
Let's talk more about how women can approach conversations around their health with their primary care provider or their OB-GYN, either preparing for birth or getting ready to give birth.
I think the number one thing for women to consider is, do you have a provider that makes you feel seen, heard, and understood? We all have intuition, so I have to bring some of that into this conversation. If your provider is someone that you can talk to and that you feel comfortable asking questions, this is number one and foundational. Because if you have a provider that you don't feel you can talk to, that you don't trust, then it's important to switch. The next thing to think about is coming to your visit prepared with questions. What are your concerns and what are your questions? The number one thing women tell me that they struggle with when they're seeing a physician is feeling rushed, and also not feeling worthy. You know, I'm too much if I have questions. I'm going to look too difficult. But it's really your time. When you're sitting there with your provider, we work for you. We are there to facilitate your care and to advocate for yourself. You must come with your questions ready. And I would say try not to be distracted. by what is going on in the office space. Did you run into somebody at the front desk where the interaction was a little bit off? Are there things going on in the waiting room? Try to stay focused for your visit. I would minimize distractors so you can really use that time with your provider in terms of putting your cell phone away. Have your list of questions ready, so if you feel that your provider is rushed or struggling to pay attention, you can just pull it out and say, hey, you know, I actually came prepared with several questions. So one of the things I ask my patients is, what is your goal for the visit today? And every provider conducts and facilitates their visit differently. I want my patients to come in with a goal in mind and to be able to express what their goals are so that I can meet their needs. I think the key is not to be afraid to speak up and advocate for yourself, because there can be fear, deeply rooted fear, as we know with history of structural racism and especially in Black and brown communities, what we know about healthcare and experimentation that was performed on Black bodies for the advancement of healthcare, for the advancement of gynecologic instruments, in fact. Women are still coming to my office expressing the lack of trust they have in the healthcare field and profession in general, and among we providers. It's very important that if women are experiencing this level of distrust, to try to work past that, because in the end, you are the most important person in your life. You are the steward of your healthcare. And how can you get past that? I would say, bring someone with you to your visit. I have patients who bring their sisters or their mothers to their visits, so it helps them be more calm, an extra set of ears to talk about the questions at hand and the goals of the visit, but also an extra set of ears to kind of hold on to the information that was received during that visit.
Community health centers in Boston, I think, are a really great resource to be able to provide more of those culturally competent interactions, language access as well. We want to encourage residents, if they don't already are connected to a community health center, to get connected to a community health center, which is located in almost every neighborhood in Boston. I think that's a great segue to learn more about your work on the support groups that you formed, yes, and how that came about, and if there are opportunities for people to be able to participate in that.
I formed an organization called Health Vows, and I created a program called the Health Vows Program because about 10 years ago, after practicing medicine, I thought there must be a bigger way to serve instead of one patient at a time. One patient at a time, one interaction at a time, which is extremely valuable. As we know, if we meet and you're a patient of mine, your reach can be far because you can have sisters and an aunt and a mom, but what I came up with was a concept to actually focus on conscious change, because change begins in our mind. And I really believe that is the way we live healthily. And I think Black women, Latinx women, women living in poverty, that we have to commit and vow to living healthily. So I created these vows to self for better health. And they go through the aspects that I see women struggle with in terms of how to live healthily. And this work really is about women going within to get in tune with their bodies, to say, what am I feeling? What symptoms am I feeling? Do I honor myself? Looking at the social determinant of health of environment, one of the vows is I choose happiness and peace daily. These programs are these small groups of about 20 women or less where we meet and we go over each vow. We talk about self-empowerment tools. How can you be empowered to pursue the care that you need? Ask questions, find the right physician, switch. How can you be a partner in the patient-doctor relationship? We go over educational topics as well. So I try to focus on some of the 5 factors that affect women. So cardiovascular disease. So we talk about high blood pressure and how to prevent high blood pressure and cardiovascular disease, diet and exercise. We go over guidelines for cervical cancer screening and guidelines for breast health. We put in a little bit of that every week so that it can be received in a way that can be memorable and not seem overwhelming, because many women feel overwhelmed when they're at their doctor's visits. And the self-empowerment aspect of the series is very key. So we talk about, what does self-advocacy mean? What does it look like? And part of self-advocacy is knowing your needs, being able to verbalize your needs to others, and getting your needs met. So that is part of being a self-advocate. And we talk about how to do that kindly. Your providers have what we call conscious and unconscious biases. So we also talk about in this workshop series how to navigate the healthcare system in a way that can be received? How do we reframe fear of asking questions, fear of going to the doctor, fear of addressing a symptom that we're feeling? How do we reframe feeling dismissed? How do we take our power back in a doctor's office visit if our questions aren't being addressed? So these are some of the things we do in that series.
Powerful, powerful and empowering. Let's turn more to postpartum, thinking about once baby is born, and how can parents continue to get support for their own bodies and for their baby, particularly around breastfeeding, as we know can often be such a challenge.
Breastfeeding is extremely important. One thing I want my patients to know is you don't have to feel guilty if breastfeeding is not for you, but let's talk about the benefits of breastfeeding. So I think the number one area to focus on in terms of support is getting educated on the benefits of breastfeeding, because we all want to be inspired and motivated. That's what motivated me to breastfeed. We had autoimmune diseases in our family. We had issues with weight problems in our family, and I didn't want my daughter to have those problems. So I was highly motivated to breastfeed, and it required reading and reading books for me to understand what that process would look like. The most important thing is to become educated because it can inspire you. As we know, breastfeeding is important and healthy, number one, for mom. So there are health benefits to mom. Breastfeeding decreases your risks of certain types of breast cancer and ovarian cancer, and also helps the mom return to her pre-pregnancy weight faster. The average woman burns about 500 calories a day breastfeeding. So who would not want to breastfeed? That's a major incentive in itself. But for mom to adequately breastfeed and not be anxious about milk supply and such, she has to be having adequate nutrition, water intake, adequate food, good food, healthy foods, and good sleep. So when you're resting, you're producing milk. So these are things to think about too in terms of mom is support. So as mothers wanting to advocate to breastfeed postpartum, it's important to look at what does my support structure look like. And if breastfeeding is your goal, find an advocate within your family. Maybe it's a best friend or your sister who has breastfed or who is going to be your cheerleader in doing that, because we have all experienced family members who might say, well, why are you doing that? Or some of the things women worry about is, will my breasts look the same? Will I still be able to feel the same when I'm having intimate relations with my partner? So see, these are some of the concerns. But back to benefits of breastfeeding, there are major benefits for baby, as we know, which can be a huge incentive for moms to think about. So babies who are breastfed are less likely to suffer from asthma, autoimmune diseases, type 2 diabetes. They're less likely to have childhood obesity and struggle with their weight long term. They're less likely to get leukemia. And also there are certain infections in the first year of life, or let's say you have the baby preterm, so before 37 weeks, where breast milk can decrease your risk for the baby having infections that affect the intestine that can be very detrimental to their health and survival. So there's so many benefits to the baby. Then we think about breastfeeding in terms of the environment. As we know, we are in some different times. It rained all last week in the middle of December, right? So we think about global warming in the environment. And with bottle feeding, we're using plastic bottles. There's a lot of different tools that you need to to bottle feed. When you're breastfeeding, you just have your breasts. And so once you get through, I feel like the first 2 to 3 weeks, it's actually more convenient to breastfeed if you are around your baby. So you're putting less plastic and things in the environment, and it's easier for moms. We also want to think about, if your goal is to breastfeed, what is your work environment like? Because the reality is many of us have to go back to work. And Massachusetts has done some wonderful things to extend postpartum leave, which I was so grateful for. But if you're going back to work and you're not in an environment that is conducive or that you feel comfortable advocating for yourself when it's time to pump your breasts, then so you can feed your baby and store that milk for later, that is something to think about. So how do we prepare? And I see how challenging it is for women. Delivering my daughter, I had her almost 41 weeks, and I had a medical doctorate. And When I delivered my daughter and breastfed exclusively because I did not want her to get some of the autoimmune diseases that ran in my own family or suffer from some of the medical issues that were in my own family lineage, when I went back to work after 7 weeks, because it was a different time then, she's 17, it was the first night I was away from her. And so my body was doing things that I didn't really understand as a medical doctor. So for women who are feeling self-conscious or fearful or down on themselves, even when we're highly educated and we're in the environment, the real lived experience, I feel, trumps everything. So I'm on labor and delivery, I'm in OB triage seeing patients for 6 hours when I start leaking breast milk. And some of the things that inhibit women from breastfeeding, such as fear, embarrassment, especially when you go back to work, I experience those, and and I have an MD at the end of my name. So when it was time for me to step away and pump, I thought, do I ask for permission? Do I tell someone? And it was a really tough night for me, my first night back. And from there forward, when you're really wanting to breastfeed your child, in your mind, you are planning when you can get away to pump, and that can be a bit stressful. So it's important to have a work environment that is supportive. And as we know, environment is one of those social determinants of health. And in this situation, a mom who is able to breastfeed her baby, if that's her goal, is decrease anxiety, maybe help with depression, help her get back to her pre-pregnancy weight. So we can see how all of these things feed in together to create a healthy mom and a healthy baby.
Thank you so much for sharing your story. I think it's wonderful to always hear and understand just how individualized each experience can be. And here at the City of Boston, I know in some of our city buildings we have the Mama Pod, which allows folks to go in and be able to breastfeed in a more quiet, calm space. We're seeing that 13% of Black babies born face infant mortality, which is twice as high as white babies at 6%. Yes. Share with us, what do you know about infant mortality, and what should we know about infant mortality?
Absolutely. So first, it's important to know the definition of infant mortality, which is death of your infant in the first 12 months of life, in the first year. And there are common causes for that. The number one cause is typically congenital birth defects. So this is something that, with adequate prenatal care, women can actually prepare for in terms of knowing if their genetic testing is normal or not. There's an ultrasound process to look at the baby to make sure that there are no birth defects. So it's very important to have regular prenatal care. We also think about other causes such as sudden infant death syndrome. Infants dying before the first year of life suddenly without a known cause. As we know, breastfeeding can decrease the incidence of that. Being educated about breastfeeding, planning out a support strategy, reading about breastfeeding, perhaps making a commitment to breastfeeding would be important, because as we know, Black women are the least likely group to breastfeed. Data has shown, and it's been that way for decades. Another cause would be preterm deliveries or low birth weight. So low birth weight is defined as birthing a baby that's under 5 pounds, 8 ounces. There are many factors that can contribute to low birth weight. Many are often, comorbidities or pre-existing health problems in mom. So high blood pressure, diabetes, not receiving adequate nutrition. Another cause for infant mortality would be accidents. So typically suffocation is one of them. So it's important for women to be educated about how do we position baby while sleeping? What are we using in the baby's crib or to swaddle the baby? Are you swaddling the baby or not? If you are, what are the techniques to do that? Are you co-sleeping with your baby, which can actually increase risk of suffocation? So those are some of the major causes that we think about in terms of higher mortality rates in the first year of life, that it's important to become aware and educated so that we can prevent those things from happening when possible.
In our Health of Boston data reports for cardiovascular disease, we see very, very high rates of hypertension and high blood pressure among Black women across the city. Let's talk about preeclampsia and how that can affect outcomes for preterm birth.
Absolutely. Before we talk about preeclampsia, it's important to talk about hypertension. Hypertension, as we classify it, is a blood pressure reading of 140/90. And so there's different classifications you think about in pregnancy. You can have chronic hypertension, which is high blood pressure that pre-existed your pregnancy. So you had high blood pressure before you became pregnant. Then there is gestational hypertension, which is where you develop high blood pressure after 20 weeks of pregnancy. But there are no signs of what we call end organ damage or kidney disease. Then we get to preeclampsia. Preeclampsia is when you develop high blood pressure after 20 weeks of pregnancy, but there are signs that there's kidney, that it's affecting the kidney. So the kidneys start to spill protein. It must be diagnosed with your physician, so they collect your urine over a period of time and actually do an analysis to see if there's protein in the urine. If you have high blood pressure after 20 weeks of pregnancy with protein in your urine, this is diagnostic of preeclampsia. Preeclampsia is problematic because once you start having this damage to your kidney or even hypertension in general can be problematic in pregnancy because it can affect the way the blood actually is distributed to the placenta. And blood brings oxygen to the infant, to the fetus, and so that can affect the way the baby grows, and it also can affect how the placenta is adhered to the uterine wall. Poorly controlled high blood pressure, preeclampsia, can actually increase risk of placental separation, which we call placental abruption, which usually presents as women bleeding in pregnancy and can contribute to preterm birth. So it's important to think about preeclampsia in the sense of how can we prevent it. One of the things with Black women is that we already have a high disparity of hypertension in our communities, whether it be diagnosed and untreated or undiagnosed high blood pressure because of lack of access to health care or lack of education or lack of support once you're diagnosed with hypertension to create the lifestyle changes that are necessary, such as diet and exercise. When you get women in their pregnancy with hypertension, if you are entering your pregnancy with high blood pressure, it can affect your unborn baby and then eventually cause issues during the pregnancy and after. We think also about eclampsia, which is when you have seizures that then appear in the setting of preeclampsia. It can increase your risk of seizure and stroke, and that can last up to 6 weeks postpartum.
Dr. Swedarsky, thank you so much for sharing all that wealth of information. Our hope is that our viewers can feel really inspired around women's health, maternal health, and be champions of having control over their health outcomes and knowing where they can access or how to access different information to be better advocates for themselves. We'd love for you to leave us with what is the most enjoyable thing about your work and what legacy do you hope to leave behind?
Oh, that's a great question. What I enjoy most about my work is the women that I meet every day. Having the privilege of being deeply involved in their lives and hearing their stories and being able to have impact in helping them navigate their health care. And I always let them know, you are the most important person in your life, that I am just a guide here. That is what I most enjoy. The legacy that I would like to leave behind, I'm constantly working on ways to further empower women through education and teach self-advocacy tools. I present workshops and programming for women where they feel inspired to live their best, their healthiest life, honoring their mind, because as I mentioned, I feel that the decision to live healthily is a conscious choice. And then once you decide that, it's about finding the individuals on your path, the mind, the body. So educating women on what are the guidelines, what is it that you actually need. It's almost like when we take our car in for repair, we get a whole booklet on what's needed, but our bodies, we don't have that. We don't have that kind of guide. And then I also think very much about the spirit of that individual. You know, that is something that is often left out of our conventional spaces, but there are important things to consider in terms of being mindful, honoring what your own internal spirit needs to live a healthy lifestyle. So I like to ask the women in my life and the patients in my practice, what brings you joy? What do you love? What makes you come alive? And encourage them to do more of that. That would be my legacy, to keep creating educational programming and safe spaces for women to honor their mind, their body, and their spirit.
I love that. Love that. Well, thank you for your time and thank you for joining us.
Thank you for having me. It's been a true pleasure.